like to see it go up and not down. We are not testing asymptomatic people yet. We're following the guidelines by the North Dakota Health Department. In today's Health Alert Network, Health Advisory, it came out again. They have loosened it up from 2 symptoms, I think, to 1 symptom. We've been following the 1 symptom for the last couple of weeks. If you still want to get tested and you don't have a symptom, I would follow the governor's advice and call the hotline and see if that can't be done. But if you're eligible, we'll test you either through the drive-through site or some other site. And want to keep those numbers up, so keep calling. One of the things Trinity Health is doing is trying to improve patient access. We were doing that before this pandemic started. We're doing it through the pandemic and because of the pandemic. And a couple of examples I wanted to share with you today about how we're trying to do that is we have recently opened a respiratory clinic. So we've created space in a clinic, East Ridge Clinic. It's on the southeast corner of the city. And we have created a clinic there for people with respiratory symptoms. That move will consolidate the caregivers around respiratory care at that clinic. They'll be safe, you'll be safe, and you'll be seen by people who know that particular condition. In doing so, we've also eased up our first care. Used to be a walk-in clinic, and it's still a call-in clinic. Again, it's a call-in at 857-7817. And folks who have any other condition outside of respiratory conditions should call and make an appointment for that same-day appointment at First Care. So, in conclusion, whether you need a test, whether you want an outpatient procedure, whether you want a telehealth visit or an in-person visit with a provider, or as of next week, whether you are in need of some kind of an outpatient surgery, Trinity Health has the right space, place, and people to get that done. Do not put off your health care. By ignoring the symptoms today or putting off the things that you should be seeing a provider for today, it's likely they'll get worse or get out of control. So do it today. Again, in-person, telehealth, to get a COVID test, to have a physician see you and set you up for a procedure or surgery, all of those can be done now. Lastly, I want to talk about masks. Again, everybody's wearing masks, which is great here. We're seeing about 60% compliance with our masking at Trinity Health. So when you come for an appointment, if you're attending somebody who is coming for an appointment and you need to be with them and gain entrance as a visitor to our clinic, we are still under that restriction where they have to need that kind of guidance from you as a partner. You both need to be masked up. So the patient, and if they are accompanied by a friend or relative, they should be masked when they come into the facility. All of our staff should be masked inside the facility as well. And so we are encouraged by the increase in number of people that are wearing masks, but we are seeing that we have some room for improvement both within our facility and across the community in other public places. We've got to get to a spot where we're comfortable and in the habit of wearing a mask. And I know it's going to take time, but I hope that as we proceed, especially as Lisa pointed out during opening up, hopefully we're getting in a better habit of having a mask with us so that we can go into those places that require masking, which should be just about every place. I think that's all I have for now. I'll wait for questions.
Thank you, Randy. Up next, we have Mayor Sitma with the City of Minot.
Good afternoon, and I want to say thank you to everybody that once again has joined us here for press briefing on what is going on not only in our community but throughout the region. We've talked a lot and heard a lot about Community Ready. Of course, as Lisa Clute from 1st District had indicated, that we're expecting the governor to announce a little bit later today in about an hour on the reopening plan for North Dakota. As we have from the beginning, we're intending to and absolutely going to follow the governor's lead on this and not, and I want to emphasize, not extend any additional restrictions. Overall, I can say that I am absolutely proud of how not only the community of Minot, but most across the region on how they've handled themselves throughout this ordeal. If we take a look back on March 11th, it was the first case that was reported positive in Ward County. And as of today, only 21, and I don't want to diminish those 21, but only 21 cases in Ward County, and that tells me that many, if not most people, have taken this very seriously and have been doing what has been asked to further dampen any community spread. It also tells me that we're ready to handle the opening up of our community based on what the governor does announce later today. Our community can likely expect this process to be more like slowly filling a bathtub rather than flipping on a light switch. It is something that is going to be gradual. If we wish to avoid a further shutdown or restrictions, continuing the CDC recommendations at a responsible level will be critical. Our best defense against returning to restrictions is maintaining the good hygiene, washing the hands, so many things that we've heard before. As Randy just pointed out, getting used to wearing those masks out in public, and of course, maintaining that personal space at all times. I think the news that we are moving forward, though, is great news for our community. I'd like to thank the community for being part of the solution throughout this over the last month and a half and moving forward. On to the reopening of the city. Like many, we're eager to hear what the governor's plans are and what the Department of Health has in store. We've begun drafting a return to work plan for our staff here at City Hall and continue to evolve that process. We did not halt many services, but some operations certainly have been changed. And we're looking right here at home in-house to bring some of those back online as the reopening process continues. We will continue to work with 1st District Health Unit and the North Dakota Department of Health on information and messaging, as well as follow the guidance on how to interact and perform those necessary functions. We likely will continue to take precautions with our first responders for some time moving forward, as we certainly can't afford a surge in cases to cripple our public safety workforce and face a further setback down the road. Now, we're excited and optimistic to get back to normal and whatever that new normal looks like, but it's important to remember normal is still a little ways down the road. Depending on today's announcement of the governor's North Dakota Smart Restart Plan, we'll outline our timeline for public meetings and opening up our facilities to the public once again. And I just can't say thank you enough for everyone that is still out there following the CDC's guidelines, 1st District Health, and North Dakota Department of Health. Simply put, that North Dakota, I think, has been able to, especially in our region, avoid what could have been substantially worse. And I think we've seen that throughout the rest of the country and throughout the rest of the world on what could have been. I do also want to remind you in terms of city operations that cleanup week was postponed. However, that the city landfill has been is open now through Saturday for you to haul out and take those items out. And a reminder to bring your water bill. And if you're looking for more information on that, you can go to the city's website at minotnd.org. As far as community members across the region, I want to say thank you to so many who have reached out. I know Jen from Ward County Emergency Management will touch on this, but for those folks that have reached out to make those masks for our healthcare workers, for our emergency responders, and those that have underlying health issues within our community, it shows a great testament of character in the community and across the region for those that are selflessly trying to help wherever help can be taken. And finally, just a short update on our police officer that had tested positive for COVID-19. Our officer is expected to be back at work on Monday. Finally, it has been a long recovery with extra precautions taken Given the nature of the direct contact within our department and within the community, and it was a little more prolonged because of the officers' need to take care of family members at home as well. We certainly are looking forward to the officer to be back in service and the entire city staff our police department to be full at staff, and we're grateful for the officer's recovery. We'll take questions after Ward County. Thank you.
All right, thank you, Mayor Sitma. I have a few things I just want to touch on behalf of Ward County, as well as all of the communities that this touches throughout the state, throughout the nation even. Due to some of the financial constraints that a lot of people have experienced due to COVID-19, our food pantries everywhere are experiencing shortages that they wouldn't normally at this time. So I would encourage you as community members that are looking for ways to help to donate to your local food pantries in whatever way that you can. While monetary donations are some of the easiest for them to work with because they can then fill their orders that they get appropriately, but any donations that you have of food are also very welcome. So I would highly encourage that here in Ward County as well as any other organization or any other jurisdiction. On that note, Minot Public Schools in particular has their own food pantry that they use to give kids that call in for any sort of donations that are needed for their family. And they're working closely with the Minot Police Department to address this. So if you have any donations that you would like to see go directly to the schools and to kids, please bring your donations to the Minot Police Department and they will accept them there, and they will work with Minot Public Schools to get those donations out to the kids. And some items in particular that are helpful for them would be things like granola bars, canned soup, Pop-Tarts, peanut butter, jelly, Easy Mac, things like that. Another topic that kind of speaks to all jurisdictions in the state as well as the nation is the census. While we have this small amount of time left where we're locked up with fuller restrictions here in North Dakota, it's the perfect time for everybody to take that time to fill out their census that either came to them in the mail, or if you didn't see it in the mail, please go online to 2020census.gov and fill it out. And a lot of people might be wondering, why should I fill out the census? Well, I'm glad you asked. The number of people counted in our communities directly affects our ability to get federal funding to help them in different programs through education, our emergency responders, highways, public transport, rural areas, and any sort of assistance to the vulnerable populations that we have. So I encourage everybody to please take these next few days while we're still all stuck inside to fill out your census. And lastly, to end things on a more positive note, an undertaking has happened here in Minot in particular to recognize people that have been working hard through this pandemic that we've been going to by trying to recognize some of our hometown heroes. So if you have somebody in the community that works in a grocery store, healthcare, as a first responder, or even a volunteer that you would like to recognize as one of our hometown heroes that's really done a lot to help our community during these times, I encourage you to email either Visit Minot or the Minot Chamber of Commerce and nominate this person. I know in particular through our office here at Ward County Emergency Management, some of the volunteers that we've seen make these masks that Randy and everybody else have mentioned, they've been absolutely incredible, and I personally would like to nominate them to be included in this because, you know, firsthand we see a lot of the first responders and medical community in this, but the volunteers are a very important aspect to it that we wouldn't be able to do what we do without them. So on that note, I will open it up to questioning. Yes.
Question for Mayor Sitma. What would be some of the first businesses that we would like to see reopen?
The question again was regarding what would be some of the first businesses that that we would like to see open. All personal, I think personal feelings aside, I think taking a look at how the closures happened would probably be the responsible tactic that I'm expecting the governor to take a look at, and that personal care services, as we've seen in some of the other states. The assumption is, with a phone conversation that we had from the mayors around North Dakota and some of the other county leaders around North Dakota with Governor Burgum earlier today, is that they're closely taking a look also at, the restaurant businesses, other service providers that have been closed, and that, I think, is the part that is going to be the most difficult to try to dial in, simply because a lot of the business models, as we were even talking earlier, are based around that 75 to 100% capacity, and many others have been very creative in their own ways in trying to keep those businesses viable at the most basic level through COVID-19. So I would expect the governor to come back and take a look at those personal care services as likely being some of the first, although I have not had any confirmation on that. So that is purely my assumption. And of course, the city of Minot, and I would expect many others to follow what the governor's recommendations through executive order are following. And I would also ask that the public, as well as some of those do start to reopen, that as we have focused on so diligently, is that the face masks and personal hygiene continue in whatever capacity is reopened, is that we keep that personal space and we keep the hand washing and hygiene at the absolute paramount when these processes do start to reopen.
I have a question for you, Sean. Is the city looking at unlocking its doors and letting the public in? And if the public does come in again, do you have requirements? Will they have to do masks?
Great question, Jill, from Minot Daily News. The question was, as far as the city operations and reopening the businesses, that likely is also going to come through a lot of the governor's recommendations as some of those reopenings. We're certainly already working through that within our own citywide task force with all of our department heads, taking those recommendations from what the governor has, and then likely for those folks that aren't able to see at home, we have removed quite a significant amount of the chairs right here in City Hall. And I would expect that to continue as that reopening happens, so that there is a 6-foot space or as much space as able for our public meetings, as well as then having those hand sanitizing stations down there. There's a bathroom on the main floor and on the upper floor, but given our nature of the City Hall, because of its openness, we're definitely going to have to be very mindful as things start to reopen, so that people aren't able to wander back into the separate areas and still maintain the safety for our city employees through that opening. So that is a process that we're working through very carefully, and I would expect as within the governor's recommendations that are coming forward to, I think, get a better idea of how that's going to look in the days and weeks ahead. But we're certainly hoping for sooner rather than later, like everybody.
For Lisa.
Hi, Jean.
When it comes to reopening, I know your guidelines just came out, and we don't know everything yet, but there's a couple of issues that have been longstanding, like in the grocery stores where they've run out of cart wipes. Is there anything that the health department can do to help stores like that get those necessary supplies to help us comply with the sanitary portion of this? Like, there's no cart wipes anywhere that we know of.
Jean's question is there anything we can do to help provide grocery stores? Is that correct? Grocery stores with wipes and so forth. We have, for carts, we have not received that request from grocery stores. As we work throughout the reopening and guidelines, we can look at that. I'm not sure of any sources that we have to provide that of right now, but it's certainly, if it's a need in the community, we can look at that and see what we can come up with. So I just want to take this opportunity to say, Mayor Sitma was exactly right. This will be a slow process. Closing went rather quickly. Reopening is a slow, guarded process. And because we don't want to undo all the good work that we have done. So we will ask that people be vigilant. You know, if somebody's going to ask if we're opening the doors at First District Health Unit yet, I can't answer that because I have a responsibility to assure that you have a public health staff that can respond and continue to respond to these issues. Also, we have come up with creative ways in which to respond to the community's needs and to continue to work on other communicable diseases. So we will, I want to reiterate that businesses will begin to reopen, but it will not be in the manner in which they were prior to closing. And we don't want that. We want them to have some modifications as they open and be more vigilant with disease control than ever before. So reopening is a slow and guarded process, but certainly a step in the right direction. So,
A
Jean.
big part of maintaining our open state is testing. Minot is one of the cities that has not had any surveillance testing. Is that something that the First District is going to be requesting happen here?
Jean's question is First District requesting that surveillance testing within this area? At this point, we have not been given the opportunity to ask for that or to put in that request. At this point, the surveillance testing has been done as a result of a hotspot identified or an issue identified. And so they are only doing those tests as a rapid response to an event at this point. When that becomes available so that we can send in that request, you can be assured that we will send it in. But right now, the testing is focused on long-term care facilities, any assisted living facilities, and then working out all the protocols and practices so that we're ready for a rapid response when a situation occurs. So every time one of those do happen, and there is a rapid response team that goes in and does a lot of tests like they did in Fargo and Grand Forks, they learn. And I think by the time we have the opportunity to do that, you know, my hope is that we are able to put in that request, but at this point that it's not happening, that's telling us that there is no concern right now or hotspot identified that we need to do that. So, thank you.
All right, any other questions? Randy?
Yes, ma'am.
You talked about the respiratory clinic and effectively separating respiratory patients from others.
Right.
A couple of questions on that. Is that going to allow you to bring back some of the furloughed employees, or has it already allowed you to bring back some furloughed employees, now that you're offering more services?
Hasn't happened yet. So we are expanding our clinic access to respiratory clinic or first care clinic using the resources we have in place today. So those furloughed employees have not been recalled. We expect that they will be in time, but that has not happened yet.
I have a person that asked about pregnancy and delivery and the restrictions on who can be there. Can you talk a little bit about what it's like or what it will be like for a mother to give birth during COVID?
So at the hospital, there is exceptions for assistance with a partner, a visitor, and that includes the NICU and the Family Birth Center. Now, the clinic side, that person, I would not be able to attend my wife's OB clinic appointment unless she is needing my guidance and whether she's disabled and needs to be helped into the building with a wheelchair, crutches, those kinds of things, that would be allowed. But as of this time, and we are looking at trying to come back from those visitor restrictions, we would like to do that today, but we are not able to do that yet. Kind of like the mayor talked about, slow filling the bathtub. We see our visitor restrictions will be eased or lifted in time. We're looking for that opportunity, but right now is too early for that. And so those appointments that you might bring your friend or your partner with, that access would not be allowed, and they would be asked to remain in the lobby or outside. And at some time, that'll be relieved, and they'll be able to attend with you, but today that's not the case.
And probably want to repeat the question. Then my final question is about testing and how the governor has specifically said that if you think you've been exposed to a positive, you should be able to get a test. That doesn't mesh with the actual guidelines that the health department has put out. So I was hoping you could address that a little bit. And then if someone does call the North Dakota Department of Health hotline and complain that they were turned down, have you received any intervention from the Department of Health from someone who has made that claim?
So the first question is around, there seems to be some discrepancy between the health advisory that the providers are using as guidelines in testing and what a viewer might watch on today's press briefing. And I can tell you that we've been following the North Dakota Department of Health guidelines since the beginning. Initially, they were a lot more tighter, and you had to have one symptom plus two of these symptoms, and it needs to be worsening symptoms or recent onset of symptoms. And so the survey, the screeners would go through a series of questions, and it wouldn't be just as easy as, do you have a cough, yes or no? There's questions behind the questions that have to get asked and answered. And if their answer doesn't match the algorithm, they would be instructed to stay at home, monitor the symptoms, call or come in if they worsen, but self-isolate or self-quarantine. Those symptoms, the guidelines have relaxed a little bit, but they still require you to have a symptom to gain a test from a provider in North Dakota. Now, there are exceptions to that, according to the guidance, as always has been the case, that if your physician is concerned about your medical history and other kind of related factors and wants to have you tested, they could have you tested. But the guidelines were pretty clear, and they still are today pretty clear, that you need to have a symptom. Now it's one symptom, but you have to have a symptom to be eligible for testing. And our screeners will ask those questions to develop the appropriate protocol. They'll follow the protocol, and they will test you. They want to test you. If you don't have a symptom and you want to test, and you're turned away at the screener at any provider in the state, I believe you've been invited to contact the hotline, North Dakota Department of Health hotline, and they will work with a provider in your area to get you tested. And I believe that is true. I don't know of any of those cases that would have been called to our region yet. We would prefer not to refuse the test. And if it reaches the point where the Department of Health wants you to come in and get tested at Trinity Health because they're convinced you should be, and you wouldn't otherwise fit the screen, I'm sure we would accommodate you. I look forward to the day when we're testing asymptomatic patients in this region. I think that's coming, as Lisa pointed out. They're testing on hotspots and follow-up to certain events in the local communities like Grand Forks, Fargo so far. They've done other asymptomatic testing in the southwest corner of the state, and in the, I think Newtown, Stanley area has done that. So there will be a day, hopefully soon, when we can offer the same thing.
I don't know if the question, I have on antibiotics. said, but there are other providers in the state, and maybe one or two in Minot, that are providing antibody testing. Do you have any thoughts on that beyond what Lisa already talked about?
The question was around, what are we doing about antibody testing? Are we doing any of that today?
Other providers.
Other providers have said that they're doing that, which is great. We agree with the advisory that was put out and is publicly available today regarding their use and their value. You need to be careful of which antibody test you use because there are being a number of them being marketed. There's some question around the validity of those that are in the market today, some of them. We're exploring that option today. We may actually start that, but I'm not making that announcement yet. We're exploring other ways, the means of testing, rapid testing, in-house testing at Trinity Health to have a quicker turnaround than the 28 to 48 hours. We're getting great service from the Department of Health. But we're looking at, as we move into a period of opening up our own access to surgeries and clinic appointments, if you're going to have a procedure or surgery at Trinity Health, you're probably going to get tested. And we're moving faster towards being able to develop that specific test for that specific patient so that we can proceed in a measured, safe, and cautious but effective way. That would not be a test that would be available for the general public at this time. But so there's a lot of work being done on antibody testings and on other kinds of testing that might result in a faster turnaround time.
Have any staff expressed their concerns about businesses reopening this weekend? Maybe about like patients or anything like that? Have they expressed those concerns to you or anybody at the hospital?
Question was, have we received any feedback around concerns in opening for business in North Dakota? I don't know of any that have expressed that specifically. I think that we all, including the mayor and the governor and this task force and our organization, are concerned about the likelihood of another spike or rise and fall. I think we're in this situation for the long term, for like the next year or two. And we expect there will be variability from day to day in the number of people who contract the virus and who recover from the virus. We're going to watch that very closely. We're going to monitor the data very closely. And we will respond as a health system, whether we have to implement new restrictions with visitation or slow down surgeries or whatever it takes, we will, again, strategically, quickly invoke those kinds of procedures. But we don't have any overriding concerns about that. Thank you.
All right. Any other questions? Yes.
One more question for Mayor Sitma.
Yes.
Is there anything that you hope to get out of Thursday's special meeting with the city?
Well, regarding COVID-19, that's what we're focusing on today. I would hope this special meeting is only able to discuss what is actually on the agenda there. But I do expect at our next regular city council meeting to likely have a further discussion on what the task force has come up with as far as actions within the city. But as far as COVID-19, nothing is on our agenda for that special meeting. Thank you.
All right. Any further questions? All right. Hearing none, thank you everybody for coming.